Hi, welcome to Ask Dr. Tan. So in this new series, what we do is we consolidate all the questions that you guys have asked us on our social media platforms and we try to answer it. Now, this week, we're going to talk about syphilis, which is a huge topic. So this video might be a bit long, so bear with me. Alright, so the most common question we get about syphilis is, what does the test mean? Okay, this is actually rather complicated. And honestly, a lot of junior doctors, they themselves struggle to understand syphilis testing. Essentially, there are two types of syphilis tests: treponema test and non-treponema test. So think of them as the tests that start the letter T and the tests that do not start the letter T. Right? So in Singapore, what we do is we do a T test first as the initial screening to see whether a person has syphilis or not. Now this works for everyone except for people who have had syphilis in the past, even though they've been successfully treated, because these patients suffer from what we call serologic scarring. In other words, the T test will always remain positive. So for such patients, and also for patients who are newly diagnosed syphilis who have a positive T test, we move on to one of the so-called non-T tests. They go by the name of VDRL or RPR. And when these tests are also positive, then a patient is deemed to be syphilis positive. Now the non-T test, it doesn't just give you a positive negative reading, it also gives you a number. And we use this number to determine, number one, if treatment was a success. That's why your doctor will always ask you to go back for repeat testing for even up to 2 years after you've been treated for syphilis. And the number will also tell us if a person who has been previously infected and treated for syphilis successfully has been reinfected. Right? So I know all this might sound a bit much or a bit technical. I think the key thing to learn here is when you do screen for syphilis, make sure you see a doctor who's rather familiar with interpreting the test results, so that he can give you the proper advice on what to do. So the second question is, does latent mean I can just leave it? Okay, this is again another thing that causes a lot of confusion. So there are 3 clinical stages of syphilis: primary, secondary, and tertiary, right? Sorry, that was my dog. So the primary syphilis is a ulcer, a painless ulcer at the point of infection, usually on the genitals, or in some people the anal genital area. So this usually comes on classically between 9 to 90 days after infection, and even if you don't do anything about it, it goes away by itself. Then about 2 to 6 weeks after that, a patient might develop secondary syphilis, which is a rash, usually on the trunk, but also involving the palms and soles. Now again, this rash, which is called secondary syphilis, can go away all on its own, and it can actually come back. That's a little known thing, and then go away again. Now this rash is called the great imitator because it is frequently mistaken for a lot of other diagnoses like allergies. And then years and years later, if the syphilis is not treated, it might start damaging the heart, damaging the nerves, damaging the brain, and that is what we call tertiary syphilis. So the question is, in between these symptoms, in between primary, secondary, and tertiary, what happens to the patient? The patient is completely symptom-free, right? And that's what we call latent syphilis. So latent doesn't mean inactive. Latent means there are no symptoms. So this question, does latent mean I can just leave it? The answer to this question is no. You must get it treated. If not, it's going to continue to damage your body internally, right? So last question, how do I know it's scarring versus latent? So good question. Remember we discussed on the first question, if a patient has been infected with syphilis and successfully treated, the T test, the treponema test, might remain positive for many, many, many years. That's what we call serologic scarring. How do we know that it's not a new infection or it's not a latent infection? You have to move on to doing the non-T test. And those numbers will let you know whether the syphilis is active or not. Right? And of course, doctors will also look at your history of infection, history of exposures, and also examine to look for signs and symptoms of infection. Right? So I think the lesson learned here is syphilis is still present in the world today. It can be quite a scary illness. It can infect you without showing any symptoms. So please make sure it's part of your sexual health screening process. And that's it for this week. See you next week.